Now, if you're suffering with fibromyalgia, you may have been told there's nothing you can do to manage the pain. However, don't give up hope yet, because I found the solution and I've got the right treatment for you. What's good, people? It's Nathan here from Cryo Clinics UK, and in today's video I'm going to be discussing the effects of cryotherapy on fibromyalgia. Now, fibromyalgia is a debilitating chronic pain disorder which affects the central nervous system through neurochemical imbalances in the brain and increased level of inflammatory cytokines. Dysfunctions lead to central amplification of pain perception, resulting in allodynia, which is heightened sensitivity to non-painful stimuli, and hyperalgesia, which is heightened sensitivity to painful stimuli. There's a lot of confusion which surrounds the diagnosis of fibromyalgia, as no gold standard has been set due to the fact that the etiology of fibromyalgia is not fully understood. However, symptoms are characterized by musculoskeletal pain, fatigue, joint stiffness, sleep disturbances, and psychological issues such as depression, anxiety, and cognitive impairments. Prevalence varies between 2% and 8% globally, making it the second most common rheumatic disease and third most common musculoskeletal condition. Fibromyalgia negatively impacts an individual's ability to work, reporting issues such as resignations, role changes, reduced hours, and decreased productivity. Consequently, this leads to dismissal, lower job satisfaction, and financial difficulties. Overall, fibromyalgia is physically and emotionally challenging, which greatly impacts daily living activities and quality of life, professionally, socially, and recreationally. So cryotherapy uses vaporized liquid nitrogen to help accelerate the healing and recovery of injuries, as well as pain management. Exposure to cold lowers skin temperature, which onsets the body's healing mechanism, setting off many physiological responses, such as vasoconstriction, calms nerve activity, regulation of inflammation, and white blood cell production. Another physiological mechanism is the release of healing nutrients and hormones in the body, such as endorphins, the natural feel-good hormone, and norepinephrine, a natural painkiller, along with other chemicals. The use of cryotherapy has been popular throughout the years through sports medicine. However, recently it has become highly effective in treating rheumatic and autoimmune diseases such as fibromyalgia. So in order to understand how cryotherapy helps with fibromyalgia, we first must understand the body's pain mechanisms and how the body detects pain. As I said previously, diagnosis of fibromyalgia is tricky, as no gold standard has been set to detect the condition. However, it is usually identified through two factors, which are widespread chronic pain, which lasts longer than 3 months, as well as pain in a minimum of 11 out of 18 palpation points. Both physiological and psychological mechanisms play a role in pain perception, and pain is detected in the body by two neural pathways, ascending and descending. Ascending, which is the transmission of sensory information by peripheral nerves and nociceptive signals to the spine and brain for processing. And descending, which is modulation of excitatory and inhibitory signals from the brain to the peripheral nerves, which regulates ascending nociceptive pain signals. These pain signals are identified through nociceptors in the peripheral nerves, which are sensory receptors designed to detect changes in stimuli such as temperature, pressure, and impact. In fibromyalgia, dysfunctions appear in these pathways, which lead to heightened pain perception known as central sensitization, causing hyperalgesia and allodynia. These are attributed to the spinal system's amplified reaction to somatic and cutaneous stimuli through the brain's pain sensory network. It has also been suggested that the misfiring of neurotransmission, resulting in an increased activity of excitatory neurotransmitters such as glutamate and substance P, accompanied by inhibition of norepinephrine and serotonin through nociceptive pathways in the spinal cord. In addition, dysfunctions are also present in dopamine regulation and disrupts the body's natural supply of feel-good hormones, as well as endogenous cerebral opioids, which outlines the central amplification and etiology of fibromyalgia. However, sensitization is not unidimensional, and it is essential that central, peripheral, and psychosocial elements are also taken into consideration. The concept of cognitive emotional sensitization was produced due to fibromyalgia's direct focus to pain points with a direct link between the body and the environment they were in. Furthermore, a similar effect can be identified in social environments and defined as interpersonal sensitization, which was demonstrated through associated shared neural pain experience. Cryotherapy has been shown to be highly effective in improving pain and quality of life after treatment by lowering oxidative stress and slowing nerve conduction velocity and activity, which reduces muscle damage and accelerates recovery. This then reduces pain and fatigue, allowing for better physical functioning. Additionally, cryotherapy has been shown to reduce inflammatory cytokines such as IL-1 and TNF-alpha, which impacts pain in the peripheral nerves. Fibromyalgia is known to have high levels of these pro-inflammatory cytokines, and they're the cause of a lot of fibromyalgia symptoms such as fevers, headaches, joint pain, and muscle pain. Conversely, cold exposure helps release anti-inflammatory cytokines such as IL-10 and regulates pro-inflammatories such as IL-1 and TNF-alpha. Additionally, treatment is known to promote IL-6, which is considered a pro-inflammatory cytokine. However, IL-6 also releases anti-inflammatory mediators such as IL-1RA and IL-10. Finally, another factor which is heavily linked to fibromyalgia and its prevalence are mental health issues. The impact of cryotherapy on psychological states has shown positive effects due to the increased production and activity of hormones such as endorphins, cortisol, adrenaline, norepinephrine, and ACTH, which help alleviate pain and increase positive mood states. Psychological mechanisms such as hypothalamic pituitary adrenal axis, which instigates depression, and opioid peptide, which influences motivation, stress, and pain, are all positively impacted through cryotherapy and cold exposure. So that concludes today's video on how cryotherapy affects and impacts fibromyalgia. If you like the video, make sure you give us a thumbs up and comment on the video, and also share with your family and friends who will find this useful. As always guys, make sure you subscribe to the channel to stay up to date with future content. And as always, thanks for watching, appreciate you guys, and I'll see you in the next one. Peace.